Good morning, all. Did you practice the technique? Did you practice the techniques? So, do you have any doubt? Okay, so we will just wait for others to join. Okay. Okay, did you had any other class before? Okay, so I think we can start the class because already it is late. It is only 1 hour class. Are you people hearing my voice?
Yes, Miss. You may start your class.
So yesterday we saw all the techniques. So today I will teach you how to do or how to perform the massage technique on a particular person. So maybe like we will start little bit today. Then on Tuesday and Wednesday we will go by areas, that is back massage, upper limb massage, then face massage. So we have four types of four different areas. So I will teach you the according to areas. I will teach you from next week. Then maybe today we will practice we will see about the general performer. Then after that I will give you few of the questions so you can discuss in the weekend. Then Tuesday when we come back we will discuss together. Then we will start with the practicals. That here. So first thing is whenever you will be given a question case scenario. So case scenario means like a complete condition of a particular person. So from the condition you have to choose the particular massage technique. That means you will be given some conditions and clues in the question. So you have to read the clues and you have to pick up massage as the treatment technique. So we will teach you during the tutorial classes and other classes, we will teach you how to choose or how to check for the clues and decide the treatment protocol. Is that clear? So first, okay, so you have been given a condition and you have decided to go with a massage. So then what is the first step you have to do? So the first step is you have to introduce yourself to the examiner. So introduce yourself to the examiner, wish the examiner whether it is good morning or good afternoon. Then you can introduce yourself to the examiner as well as to the stimulator. Uh, so from last semester, actually, like I was not that much happy about your last semester's OSPE performance. So that's why like this time I have decided to go very slow, and I will be giving you ample of time so that I can watch you do the to do the technique. Is that clear? So maybe someday, like maybe if possible on Tuesday and Wednesday, if you have any of your siblings, you can keep them with you so that you can perform and show. Because previous semester, like you were lacking in a lot of aspects. So I thought of explaining that in this semester when you come face to face. But unfortunately, this semester also I don't know what is going to happen. So we will go little slow. We will go. Many of the practicals will be like video presentation, so that I will be able to watch you and I will be able to correct your mistake. So the first thing is you have to introduce yourself to the stimulator, stating that you are the student physiotherapist and you are in charge of him for the particular session. Okay, so introduce yourself like this. Then next step is you have to explain the procedure. So explain the procedure means you need to explain what is the problem of the patient. Then you need to explain what you are going to do. Then third thing you have to explain how it is going to help him. So first is what is the problem of the person, that will be in the question. So from the question you can explain them. Then second is what you are going to do. So for example, if you're going to do massage, so you can clearly state them that you are going to perform massage, and you are going to perform back massage, and this massage will help him to reduce the pain. This massage will help him to reduce the spasm, or this massage will help him to relax himself. So according to the question, so in case if the in the question if they have stated that uh, if they are saying that the particular person has low back pain, he is a software engineer and he used to sit for a very long time and he is having low back pain, and because of the pain he is not able to sleep at night. So this is one kind of a question. So from this question you can explain like this. Sir, from the question, from the case sheet, I come to know that you have low back pain. And the low back pain is because of your, because of your profession. You were sitting for a long time. That's why it is leading to low back pain. So I'm going to give you massage. This massage will help you to relax your back muscles. And this massage will help you to reduce the pain so that you will be able to sleep normally at night. So this is how your procedure, explanation of the procedure should be. So keep in mind 3 points. One is explain what is the problem of the person, explain what you are going to do, explain how that is going to help him. Then after explaining everything, then you can say that check for the contraindication. So check for the contraindication. You in the theory you have learned many contraindication, that like general contraindication, local contraindications, all those things. Maybe from the contraindication, at least 5 to 6 you can just ask them, but ask them related to the proper condition. That means if they have low back pain, then according you are going to give back massage. So for the back massage, what are the contraindications? That one you have to ask them. Don't ask whether you have leg pain, whether you have leg swelling in the leg, whether you have edema in the face. So these are irrelevant contraindications. So you have to at least say some 5 to 6 contraindication which is relevant to that particular condition, or which is relevant to the particular procedure you are going to do it. Because in massage you will be having nearly 20 to 30 contraindications. So you have to choose from that. Is that clear? So that is about contraindication. Then the fourth step is, after asking about the contraindication, fourth step, you have to get the concern. So getting the concern, you have to ask them. You should not just ask, can I get your concern? Not like that. So you have to ask like this. Sir, while doing, I need to touch some of your body part and I need to undress some of your body part. Is that okay? Can I get your concern? Is that clear? So get the concern very clearly. So when you perform these 4 steps in a very confident manner, the examiner will get a very good, very good opinion on you. So he will be getting ready to give you full marks. Is that clear? So when you don't perform these 4 steps, which is the normal and the general steps, if you're not performing this 4 steps, then the examiner will think that you are not that much confident in that particular chapter or particular technique. Is that clear? So when you do this, then this will give a good response from the examiner. Is that clear? So you need to be very confident, talk boldly. Last time, like even talking to your parents or siblings, you were many were not very confident. You were very stagnant and the flow was not smooth. That is one thing. Another thing is, when you perform station by station, each station you need to introduce yourself. Each station you need to explain. So all these 4 steps should be there in each station. So many of you, what you did is you just went off with one introduction and with one getting the concern, you just performed all the stations. But actually you should not do that, because each station will be you will be given marks for each steps. So if you miss in any one, then they will not give you marks. So you cannot get full marks. So you just keep this in mind. So you need to go do all these 4 steps in all the stations. Even this time also, if it is online, so most of the time it will not be online because the condition is getting back to normal. If at all, if at the worst, if it is an online exam, don't perform like last time. You have to perform all the steps in all the stations. Is that clear? So this four, like everybody, are you clear with all these four steps? Are you clear? Okay. Um, I think there are only 41 students present. Class representative of our both R10 and R11. Please let me know who is absent. Because in Zoom ID, it is very difficult for us to find out who is absent. Is that clear? Okay. So next one. So next is position of the stimulator. So here, position of the stimulator means position of the patient. 1 minute. So position of the stimulator. So depending on the condition, you have to position. So here we have nearly five or six types of condition. One is like back pain, then upper limb, lower limb, then a massage for the face. Then sometimes depends on like scar tissue mobilization. So for the back, you need to position the patient in prone lying. For the upper limb and lower limb, you can position the patient in supine lying or then prone lying. In case if the patient is bulky, then you have to do in supine, then later turn them in prone and you have to perform in the prone lying. So this will be the thing. For the face, like you need to position the patient in supine lying and you have to sit at the near the face, near the head. You have to sit behind the head. Okay, so I will take the images and I will post it in your WhatsApp group later regarding the positions. Then, so this is about position. Then depends on the scar tissue. So if the person, sometimes you may get condition like the person is having trapezius tightness and you need to do massage to relax the tightness. So in this case, you can position the patient in sitting. So if the person is having scar tissue in the forearm and he is not able to bend his forearm and you need to give massage to reduce the scar tissue, then again you can position the patient in sitting with the hands on the table. So these are the positions we are going to follow in massage. Then next is position of the therapist. So position of the therapist is always walk standing position. So walk standing position means so you can see one leg forward and one leg behind. Okay. So this is the walk standing position. So I'll give you a clear positions pictures. Maybe I'll send you in WhatsApp or I'll post it in LMS so that you can understand clearly. So walk standing is one leg forward, another leg back. So why you want to stand in walk standing? So this will help you to do the movement very smoothly. This position will help you to reach all the areas of the body. So if you want to go lower limb, you will be able to go. If you want to reach the head, you will be able to reach it. So that is why we normally go with the do in walk standing position, because once you start massage, you should not stop in between. So you have to keep continuously doing it. So that's why you don't need to you should be in walk standing position. Okay, so that is about position of the therapist. Then next is preparing yourself. Preparing the patient, then preparing yourself. So this two was very, very important. So preparing the patient is, so after positioning the person, you need to uncover the areas you are going to treat. So in case if it is a face, then you have to just put a band here in the head so that the hair is not coming inside and disturbing you. So you can just put a hairband here and you can just correct all the hairs, put everything inside. So this will help you to avoid disturbance during your massage. In case if you are doing for the back, you have to ask him to remove the upper dress. Then position them in prone lying and cover their lower back. So you have to cover in such a way that you are covering the complete lower with the towel tucking in the pant. So this will help them to avoid or uh, spoiling their pants whenever you are using the lubricants. So you need to clearly tuck in the towel inside the pants and you have to cover the lower. So why you want to cover them properly means one thing is to avoid little bit embracement of the person. Then second thing is normally the massage room will be little cool. So normally the massage room will be little cool. So the person maybe feel themselves like very cold uh, during the treatment process. So mostly the treatment will take more than 30 minutes. So sometimes they may shiver due to the air condition and other. If it is very cold, then it will be difficult for them. That is one thing. Another thing, if they feel is very cold, automatically the muscles will go into spasm. So you will not be able to relax them properly. So that's why you need to cover them properly. Then in case if you're doing for upper limb, then you can only undress that area. You don't need to undress completely. Okay, so this one you have to keep in mind. Then the next point is very, very important. You have to be very careful. You have to remove your watches. You have to remove your rings. So no rings. Then another thing is no bracelet. Okay, so when you're using bracelet or bangles, whenever you're doing the movement, it will be keep touching the patient's body and that will cause discomfort. So you need to remove watches, you need to remove bracelets, bangles, or any other threads and other thing. You need to remove the rings and other accessories in your hand. And your hand should be very smooth. Is it clear? So you need to be very careful. Your hand should be very smooth. It should not have any scar or it should not have any roughness. If you have roughness, then you will not be able to do the massage properly. Okay, so that's why like if you see the traditional massaging persons, their hands will be very soft. They will be maintaining their hand very softly. Otherwise, they cannot do the profession. Okay, so you have to keep all these in mind. So these are the general performer you have to keep in mind. So this is general for all, like everything you have to, for all the condition you have to follow this one. Then next is, in case if you're given the whole body massage. So in that case, you have to start with any one area, then you have to go for the next. Is that clear? Then I have just given you a general sequence of doing the massage, but according to the condition of the person, the sequence will vary. That means for back pain, the sequence will be different. For scar tissue, the sequence will be different. For muscle spasm, the sequence will be different. So this is just a general performer for you to understand. Okay, so you know need not to follow the same sequence for everything. So there will be definitely difference in the sequence. Then, or in case if you are giving for the whole body, the order of a massage will be you have to start with hands, then arm, feet, leg, thigh, abdomen, then chest, then last you have to go with the neck. Okay, so this is the sequence in case if you are doing the whole massage. Then turn the person to back, then back of the leg, back of the thigh and the back. So this is the order in case if you are giving the whole body massage. But we physiotherapists, we don't go do this whole body massage because we give massage only for the condition and only if it is needed. We are not a massage therapist, so we are not going to give the whole body massage anywhere. we just give massage, and we choose massage whenever it is mandatory. Okay, so whenever the patient asks you to do massage, you should not do massage. You have to choose massage if and only massage is the technique. If it is mandatory, then only you have to choose the massage. Is that clear? Okay, so far, any doubt? Okay, so far you don't have any doubt? Okay. Okay, then now we will go into back massage, or else 1 minute. We will just discuss about the case scenarios. Then we will go into the particular technique. So this is how you will be getting the question. So the first question is, if the 20-year-old girl is not able to close her left eye properly and also finds difficult in drinking water. History reveals that she used to travel in her motorcycle in cold nights daily. Your senior has diagnosed as left facial palsy and asked you to do massage. Demonstrate how well you will be applying facial massage for a person with left side facial palsy. Okay, so this is a question case scenario. So they since like you are in the second year, you will not be able to diagnose the condition. That's why they have given you the diagnosis. So otherwise, usually they don't give you diagnosis. Is that clear? Then they have here in this question there is no clue. Directly they have asked you to perform the massage on the particular person. So for this condition, how you will do it? So you will be, if for example, if the person is lying like this, you will be, this is the head part, you will be sitting behind the head like this. So you have to, they will be lying here and you have to sit in a chair in such a way that like the table should be little more little bit down, so that like you are able to, you don't need to lift your hand, the hand should be down. Is that clear? So you have to position the cot in such a way that when you're sitting, your hand is just in right angles. The hand should not be up or the hand should not be down. So position the height of the cot in such a way that it is at, your hand is at right angles. Then you make the person to lie and the head is near you. So you have to sit behind the head. Is that clear? Then afterwards, like you have to follow all the so you have to follow all the 4 steps. That is, you need to introduce yourself to the examiner, you need to introduce yourself to the stimulator, you need to then explain the condition, then check for the contraindication, then get the consent, then position the patient. So you will be positioning the patient in supine lying. Then get ready, make the person ready. So you can wear a hair band over the hair and you have to pull all the hair behind. Is that clear? Then after that, you need to get ready. So you need to remove all the rings, watches and everything. Then you have to get ready. Afterwards, so this will be the position of the person. Then after this, you need to apply the powder. So you need to apply the powder in your hands. So don't apply the powder in just near their face and don't do like that. You should not do like that. So what you have to do is you have to, since it is facial massage, you need to ask the person whether they have any allergic to powders or whether they are okay with the particular oil. So lubricants can be oil, can be cream, lotion or powder. So you have to ask them what is whether they are allergic to certain things. If they're not allergic, then you can use that particular product. So in case if they don't have any allergic with powder, then you have to take the powder near or down to the cot. You can apply on the hand. After applying on the hand, okay, don't do like this. You have to apply on the hand. Then you can do like this. When you do like this, the powder will be just spreading all over your hands. Is that clear? So don't just dust the powder. So put it on your hand, then do like this. So everything you should not do in front of the patient. You have to do behind, down the cot. After doing that, then you can start your massage. So when you are starting your massage, first thing what you are going to do is you are going to spread the lubricant over the face. So you can do the touch. So just imagine, so the normally the head will be like this, okay. Just for support, I'm just keeping on my body, okay. Don't think that you have to keep your head on the body. You should not keep like that. The head has to be separate like this. So I'm just keeping so that it is easy for me to hold the pillow, otherwise the pillow will fall down. Then you can start with touch. So you can touch on the forehead, on the cheeks, then on the chin. Okay, so when you touch like this, almost you have covered the whole face. So this one, you have covered the face, you have spread the lubricant. Is that clear? Then you can start with stroking. Stroking is nothing but same like effleurage. You will just do with your fingers. Okay, so you can do like this. So you should not remove your hand. So what you can do, you can start from the chin, you can come to forehead, then again you will go back, then again you will come, then again you will go under the eyes, then near the mouth, then chin. Is that clear? So like this. So this is called stroking. After stroking, so usually stroking will be from proximal to distal. So here, since it is face, it will be just opposite. It is coming from distal to proximal. But for other parts of body, it will be from proximal to distal. Okay, then effleurage will be from distal to proximal. But only in case of face, it will be from proximal to distal because the lymph node is in the neck. So you are going to drain the fluids in the neck. So that's why you are doing from the forehead to the cervical. Okay, so that's why you are doing from proximal to distal. Is that clear? Then, so after doing the stroking, then you will start with effleurage. So effleurage, you can do both hands or you can also do single hand. Since in this condition, it is only left side. So you don't need to do massage in the right side. You can just do in the left side of the face. Is that clear? So you can just perform in single hand. That is also enough. Okay. So just for your understanding, I'm doing in both the hands. So you start from forehead, you just rub, then come over the face, then come to the chin and drain to the neck. Okay, so you have to drain to the neck. So from the face, you start like this, then come drain to the neck. Is it clear? From the forehead, drain to the neck. Then next stroke, so you will start here, drain to the neck, then come back without any pressure. Then again you can do. So normally you need to do 3 times effleurage over one area. Then you can just go down to the cheek. That is under the eyes. Is that clear? So under the eyes you can do. So for example, you will be starting from here, then you will be going down, then you will drain completely, then come back. Then again, you will be doing, so like this, you will do 3 times. Okay, then after that, you have to come here, then you have to drain. Is that clear? So like this, you have to do. Then afterwards, I think I can perform on my face itself so that it is easy for you to understand. So only thing is like a little bit direction, the hand will should be straight like this. It should not be like this. Since I am doing on myself, it is little bit tilted. Don't do with tilted hand. You have to do straight hand. Okay, so like this. So this is effleurage. So after effleurage, so after you have to apply powder, otherwise you will not get the smoothness. Okay, so after effleurage, then you can go for circular kneading. So here, since the area is very small, you can give circular kneading with your fingers. No need a complete face, complete hand. Okay, so you can do circular kneading from top. Okay, always begin everything from forehead, then slowly come here, come here, come here. Okay, so you can, if you're not able to cover this area, you can also do with your thumb to cover up the area. So depending on the area, you can just change your contact, either finger or thumb, like that. Then you can cover up the chin, then come down till here. Okay, so when you are doing, you have to do complete like this. So when you're doing on both sides, okay, then you have to complete till here. So you can use your thumb to give circular kneading over the left. Over this area, when it is small, you can give over that. Don't give anything over the eyes. You should not give anything over the eyes. So except eyes, everything you have to cover. Then after circular kneading, once you come here, then you can also just come up with the circular kneading and finish off in the forehead. Then afterwards, you start the effleurage. Okay, so afterwards you start with the effleurage. So after effleurage, you can go for the other technique. You can go for tapping. So effleurage you will complete here. Then you can start tapping from this area. So keep in mind, you should not remove your hand. It should have a complete contact. So give tapping all over the face. After giving tapping once or twice, then you can also go for effleurage. After effleurage, then you can go for hacking. So hacking you can give only over the muscle. Okay, so you cannot give hacking over the eyes, over the forehead, because there is no much of muscle. So hacking you can give only in this area, not over the chin. So only in this area you have to give hacking. Okay, so you can give hacking. You can also give ringing. So you can hold and you can also give ringing. Okay, so you can give beating, pounding and all you should not give, because the face is very sensitive part and you have to go with the lightest form. So no need to give cupping here. And if at all, if you want to give cupping, you can give over the eyes like this. You can, no need to give compression, cupping, beating, pounding, all those things you have to avoid. Okay, so then you can avoid skin rolling also, because in the face, if you are doing skin rolling many times, it will be pulling the skin and later they will have wrinkles on the face. So you have to be very careful when giving facial massage. Don't give very strong techniques. Okay, so you have to avoid pulling, stretching and pulling of the skin. When you give a lot of pulling techniques, it will lead to it will lead to looseness of the skin, which will lead to wrinkle formation. Then the patient may sue you back. So you need to be very careful. So go with very mild techniques. Then one more technique you can give us, that is called as arbit stroking. Okay, so over the eyes, you can just do the arbit stroking. Okay. So like this, arbit stroking. Then you can give friction. So you can give friction over the arbit like this. Okay, while giving down, you need to be very careful. Don't give too much pressure so that the eyes will come out. Okay, so you need to be very careful. Just give the friction. So you will be giving the friction like this around the eyes. Okay, you can also give friction over the chin. In this area, you can give friction. In this area, you can give friction. Then over this, if they have any bony area, then over this area also you can give friction. So compare to your facial massage. Compared to your back massage or upper limb massage, lower limb massage, the facial massage pressure should be very less. So you should not apply too much pressure over the face. Is that clear? So, okay. Just let me check whether there is any other technique. Okay. So you will start with stroking, effleurage. You can give transverse friction over the forehead. Okay, so forehead, you can give transverse friction like this. Or you can use 2 fingers and you can do this kind of friction. Okay, all over the forehead you can do it. Then circular friction over the arbit, that one I showed you. Then you can go for stroking the arbit like this. This is stroking the arbit like this. Then circular friction over the face. So over the face, wherever you have bony area, you can go for circular friction. Then you can go for tapping, circular kneading, hacking, and lastly compression. So compression in sense, like don't give too much pressure, only like this. Like rather than compression, I think you can give the touch over here like this. Okay, so that is enough. So this is for your facial massage. So here, one thing you want to know is, so you can give facial massage for improving the skin tone. Okay, so that's what like normally girls go for the beauty parlors to go for do a facial massage. So that will enhance the skin tone. That will reduce the scar tissues. That will reduce the pimple formation. Again, that will be reducing the dark skins or pigmentation. Okay, so for all these things you can give massage. That is one thing. Another thing is you will be giving massage for the conditions. So conditions like this Bell's palsy. So normally what is Bell's palsy means? Bell's palsy is like the nerve that is coming to the face will be affected. So you have upper motor neuron lesion. and lower motor neuron lesion. Upper motor neuron lesion means from the spinal cord to the brain. So when the seventh cranial nerve is affected in the upper motor neuron lesion, you will have problem with one side of the face. That means when you're the complete in that case you will have problem with the whole face. Okay, so at least the 3/4 part will be affected. So if you learn, like you will learn about this condition when you are learning your neuro. That's why I'm not going in depth about the condition. Okay, so here when you say Bell's palsy, it is called as lower motor neuron lesion. So when it is lower motor neuron lesion, one side of the face will be affected. Okay, so this side will be affected. So the person will not be able to close the eyes. The person will not be able to close the mouth. And since this side you don't have neural control, this part of the muscle will be pulling too much. So they will have deviation of the mouth towards the sound side. Towards the good side, they will have the deviation. So in that case, they will have like this. Okay, the face will be like this. So in this case, so when you are doing effleurage, when you are bringing from here, you need to give more pressure in the upper quadrant. When you are coming here, you need to reduce the pressure, because if you keep on pulling here, giving with the same pressure, the mouth deviation will be increasing. Already the mouth is deviated towards this side. When you apply the pressure, then the mouth deviation will increase. That's why in case of Bell's palsy alone, what you have to do is, when you do effleurage from here, you need to apply good pressure so that the eyes will be closing. When you're coming near the mouth, you just reduce your pressure. Then when you're going back, you need to give good pressure here. Then when you're coming here, you need to reduce the pressure. Is that clear? See, the techniques will have to be modified according to the condition or according to the need. So in this case, since Bell's palsy, the person will not be able to close the eyes. The eyes will be open. So in this case, you need to give pressure and close the eyes. Okay, when you're coming near the mouth will be deviated towards the opposite side. So you reduce the pressure, and when you're going back, you increase the pressure so that the muscles will be pulled opposite side. Then when you're coming here, again you have to reduce pressure. So this effleurage you need to keep in mind. This you need to follow in case of Bell's palsy alone. Okay, or to persons whoever has the mouth deviation, so you need to do opposite, means you can do like this, do the same technique. Okay, so this is the only deviation from the technique. And another deviation is in all other condition, effleurage will be given from distal to proximal, but only for this condition you will be giving from proximal to distal. This is to drain the fluid towards the lymph node, okay, in the neck. Is that clear? So now you tell me if you have any doubt. Actually, if I took a lot of videos, but the videos are, all the videos are uh, sometimes they are not related. So they have many different techniques they are using in between. So you might be so much confused if I give you the YouTube videos. So that's why I'm just demonstrating on myself. Okay, so do you have any doubt? Okay, so we have 10 more minutes. So I'll give you 5 more minutes. You quickly practice on the pillow, and you just tell me if you have any doubt. Is that clear? So I'll give you 5 more minutes. You quickly practice on the pillow, or you can also practice over a teddy bear or anything. Then you can just tell me if you have any doubts. Because without practicing, you won't get doubt. And when you practice only, you will find the difficulties. That's what happened in last practicals. many of you did not practice at all. So while performing during in the OSPE, you had a lot of difficulties. Okay, so I give you five minutes. So sharp 11:55, I'll come back. Then if we have any doubts, uh, we will uh, we will clear the doubts. Hmm? Okay, so far, do you have any doubts? So practice the facial massage. Maybe you can practice on your siblings or your parents. So when you are using powder, you be careful because some people may have allergic to powder. But without powder, don't do it. So you be careful on that. Is that clear? So if you have any further doubts, we will clear. We will check on next week. Okay. So thank you all. I have my next class by 1 o'clock, 12 o'clock. So I'll end the class. Okay. Thank you.